Good morning. 29 September is the World Heart Day. Happy Heart Day to you all. Why World Heart Day? The purpose is very serious. In the past, when I was a child, or when maybe my father was a child, most of the people died on the earth by communicable diseases. Humankind was smart, we found out ways, we invented new ways of fighting disease, we conquered many infections, and then rose a new monster, the non-communicable diseases, the heart attacks, the strokes, the blood pressure, the diabetes, cancer, and so on and so forth. If you look today, 2019 end, every year 17 crore 9 lakh people die in the world of cardiovascular diseases, what we call as CVD. And if we don't do anything to this, by 2030, it will be 23 crores who will die every year. Now this is serious and something has to be done. What has to be done to reduce these deaths is very simple, and it's only a matter of awareness. And if we create awareness, 80% of these deaths could be reduced. If you look at the screen here, I will just jump these slides. You look at the world, this violet color are very heavy deaths, and our India comes in the entire violet. And if you look at what causes all this, there are modifiable and non-modifiable factors. I was born to some lineage, that's non-modifiable. I'm a man, not a woman, that is non-modifiable because men suffer more. But modifiable risk factors are important because we can act on them. And there was recently a very important paper which published in Lancet, a very upmarket journal, and it divided these modifiable risk factors as A, metabolic, which means blood pressure, diabetes, abdominal obesity, and so on and so forth. The behavioral modifiable risk factors like smoking, excessive use of alcohol, depression, and also what we call as the psychosocial factors. So if you look at this chart here, this figure here, that the upper ones are tobacco smoking, diabetes mellitus, high cholesterol, high blood pressure, sedentary habits, not exercising, middle obesity, along with that also excessive salt intake. But there are certain new factors which have been brought to light, that if you grip somebody's hand and ask him to grip really hard, look at the strength. If the strength is less, this is now termed in textbook as one of the risk factors. And also poverty can be a risk factor which we never knew in the past. So if these factors are combated, then by the individual, by the society, by the governments. That is why this time, like every year we have a slogan for the World Heart Day. The slogan this year is my heart, your heart. That means I will take care of you, my wife, my children, my family. And our heart, as a community, as a government, will take care of everybody's heart. What do you mean? My heart, modifiable risk factors, only 4. A 4-pronged program. A, every day, just 30 minutes I will devote to walk, cycle, jog or swim. No fancy machines, no money spending, only 30 minutes every day. I will not smoke. 3, I will eat right. Semblance of right. I don't want any fancy diets. My ancestors have over last hundreds of years put together such a noble lifestyle. I have been destroying it over last 50 years. I will eat right. And 4th, I will not have excessive use of alcohol. A peg in a week is okay. So just 4-pronged program, and if I stick by it, there's an 80% chance that these deaths would come down. What's the target of World Heart Day? By 2025, these deaths, 17.9 crores, should reduce by 25%. And it should go on reducing. On the eve of World Heart Day, I must also congratulate companies like Healthium and many others like them who have been producing wonderful equipments, devices, disposables, drugs in the area of helping the cardiovascular disease patients and doing a human service over decades. So happy World Heart Day to you all, and let us take a pledge, my heart, your heart and our heart. Thank you.